Welcome back. A new mutation of the COVID-19 virus is circulating in South Africa. According to new research published this week, the C12 lineage was first detected in Mpumalanga and Gauteng in May this year. It has since been detected in 7 of the 9 provinces and other countries like Botswana, the DRC, Mauritius, New Zealand, Portugal and Switzerland. We're joined now by Professor Tulio Oliveira, Director of KRISP at the University of KwaZulu-Natal, to talk to us about this. A very good evening to you, Professor, and thank you so much for speaking to us. So, researchers who found this through genome sequencing, were they surprised by this mutation?
Yeah. Good evening, Sapisa, and to all your viewers. Yes, we were surprised with this new lineage called C12. So what we do in South Africa, we run a very effective network for genomic surveillance, which involve our organization, but also the NICD and another 7 different universities and the NHLS in South Africa, where we commonly genotype the virus of infected individuals. Yeah, and what we know at the moment is that the Delta variant, which many of you are very familiar, has causing the majority of the infections. To be honest, over 95% of the infection. But what we have seen in the past weeks, is this persistence of this new lineage called C.1.2, which has many mutations, and some of them very similar, the Beta variant, the one that caused our second wave. And what we do with that information is just to make sure that we are one step ahead of the virus, so we can detect variants before they really emerge and cause big waves, but to make sure that our vaccines are very effective, which we believe to be that the case against the Delta and this new lineage, the C.1.2.
I understand that this is possibly as a result of prolonged COVID-19 infection that this mutation has occurred and probably escaped the immune system. If you could just explain to us the science of that, and how many times can a variant mutate? I've heard in some cases scientifically as many as 30. Okay,
thanks, Peter. So let's just explain that in simple terms. Yeah, there is 2 main reasons that variants evolve very fast. The first one is when you have continued transmission of SARS-CoV-2 in a non-protected population. What it means at a population that have lower level of vaccination, which unfortunately is still the case in South Africa, despite we increasing the level of vaccination very fast. And this, for example, is not currently happening in the UK, in the United Kingdom, and many of you will see this very full stadiums. It's still relatively high level of infections, but very low deaths and not emergence of variants, new variants, just showing the importance of increased vaccination to protect not only the economy and the health of the population, but also to avoid the appearance of variants. So that's one and the most important thing. The second way that these variants evolve is inside the body of immune suppressed individuals. We know that from over a year. For example, the Alpha variant that emerged in the UK when they had low level of vaccinations was linked to an immune suppressed cancer patient that was, the immune system was so low that they keep infected for hundreds of days, and then the virus keep evolving on that because your immune system cannot clear the virus. In South Africa, we also have found similar cases, but in the case on immune suppressed individuals due to HIV, this means people that are not effective on antiretroviral therapy. On the other hand, what we have found, individuals that are HIV positive positive but on antiretroviral therapy can clear the virus very, very fast as a normal individual, and that avoid the evolution of the virus.
I'd imagine that you would understand that a lot of South Africans are apprehensive about the genetic landscape, given the fact that we are those who have decided to go get vaccinated. So would they escape this treatment of the alpha beta because of this new variant? No, Sepiso, that's a very important question. Yeah. So what we know from this variant, even if it's a very new variant being discovered, or it's not even a variant, we haven't got a variant naming, that's when the world start worrying about that. What we know about this lineage, the C.1.2, it have common mutations that we have seen in other variants. And these mutations are similar, for example, to the beta and the gamma variant. That's the ones that cause the second wave in South Africa, but also a devastating wave of infections in South America. And we know that even with that mutations, the current vaccines that is being used in South Africa is very effective against the virus with that mutation, especially in South Africa, because a lot of the selection of the right vaccines were done when we had the beta variant that have similar mutations. So we do expect, and we are quite confident, that the current vaccines that are rolled out in South Africa will be very effective against this lineage. And more important than ever, we should be increasing the rollout of vaccination to avoid infections to keep high and avoid appearance of new variants, because the last thing that we need in South Africa is all the big waves of infection, because we are just coming back to our normal economic levels, and at the moment this pandemic already have caused enough harm to our country. So what are you learning when you're studying these variants? I hear you say in this one it has not been labeled a variant yet, but when you saw what happened in terms of transmissibility of the alpha, beta and gamma variants, what did you learn from that in terms of the substitution rates?
Yes, thank you. So we have learned quite a lot, especially in South Africa. Our genomic surveillance network in South Africa, it's considered to be one of the best in the world. It's praised by many international countries. Once we identify a new lineage, the first thing that we do, it is make sure that our Department of Health is well informed, and also to inform the World Health Organization Evolution Working Group. This is the evolution. This is the group in the world that keep an eye on these lineages, and then decide to assign them either as variant of interest or variant of concern, which variant of concern is the one that concerns the whole world. We just had a meeting today again with the WHO. Today the C.1.2 was put as a variant on alert. What it means is not still a variant of interest, is before that. And we are keeping an eye, not only as a South African community, but the international community, on increase of this lineage. That kind of information is very important to discover as early as possible, because that allows us not only to increase vaccination, but make sure that our public health response is very appropriate to the virus that is circulating. But we don't need to be in panic or alarm. This new lineage, C.1.2, is current only at 2 to 3% in South Africa. We still have this Delta variant, which is extremely highly transmissible, but which the vaccines are very highly effective against.
Thank you so much for that update and informing us on that, as you say, variant on alert C.1.2 lineage of COVID-19. Professor Tulio Oliveira, Director of KRISP at the University of KwaZulu-Natal.